Thumbs up, great, thanks. Hi, I'd like to introduce myself. My name is Eveleigh. I'm a clinical specialist OT and I work for Sunrise Medical. I'm a clinical educator and the other half of my role, I look after the J portfolio. And I'd like to introduce you to the new J Easy backrest that we've got. It was launched at the start of the tail end of the summer now. And I'd like to just talk you through really the key points of it. Being an occupational therapist by background, I'm absolutely hot. I love the clinical side, making sure everything is right. That's why we are all in this room, because we value the seated position of the user. I like the products, but also want to make sure that I get the maximum, the end result. It needs to be absolutely fine, meeting the clinical outcomes. Okay, so the presentation contents that I've got for you today. First of all, I'm going to be looking at why is a solid backrest so important. I posed a question at the start, when we look back at this particular slide. Solid backrests, are they the best way forward? There's lots of conflicting arguments when you look at that and discussions around that. But I'd like to sort of walk you through that really and then hopefully make some sort of decision towards the end. Okay. I'm going to talk you through the background into the J Easy development, the design concepts, the target user group, the key features of J. Now, as you know, straight outside this door here, we've got the main stand where these products are actually located. So feel free to come up and see them, spend a bit more time, have some adjustments in them, sit in them as well. A big driver for me is the clinical application, and I know that's why we're here today. So I'm just going to move through these bits quite quickly in order to get to the clinical application. Okay, the problem, we've got inadequate back support. We see it in so many of our users. How many people actually get people coming into clinic looking like this? This typical kyphotic shape. Posteriorly pelvic tilted. People who've been sat in wheelchairs for such long periods of time. And from our estimates, only 10% of all wheelchair users tend to use solid, contoured, manufactured backrests. But when you look at that in an office setting, how much money has been devoted to workstation analysis, ergonomic design, backrest, a seating station? How many times do you see a person sat in the user in an office chair like that, with a C-shaped curve in their spine? You don't tend to see that, because lots of money has been in there, lots of studies have gone into that, looked into getting the right support for people. What would be the consequences of poor back support? Well, we're going to get flattened lumbar curves, we're going to get increased thoracic curves, increased cervical extension. All these can lead to poor postures, as we can see here. These muscles are working extremely hard. The postural consequences when we look at these, there are many things. We have muscles, ligaments, tendons, discs, nerves, bone. All of these are going to have an effect of when the body is compressed into those deformed positions. With that then, we're going to get lots of overstretching and compression of tissues. These are inevitably going to make the user have to work very, very hard within their seated position. But there are going to be physiological consequences, as we know as prescribers. The physiological consequences, as we sit in that fixed posteriorly pelvic tilted position, we have the stomach pressing up on the diaphragm, pushing up into the lungs, reducing the vital capacity of the lungs. So pulmonary function is compromised. Cardiac function is going to be compromised. When we have people sat for long periods trying to be inefficient in their propulsion, inefficient in their seated positions. We've got problems with bowel function, bladder function. These are all going to be physiological consequences that we're going to see. As an occupational therapist, my focus is on making the user as independent as possible in all activities of daily living. With that, function is an absolute key driver for me. With that, when we take the user who's sat in that typically kyphotic posture, trying to reach arms up above the head, certainly above shoulder level, is impossible due to the anatomical constraints of the joints and the shoulders. How many users do you know actually suffer from back pain? When they come into your clinics and they say, oh, how are you sat in that chair? Report with lots of back pain. This is something that we need to try and improve people's seated posture. So when we look at the actual seated posture, we're looking to try and put support in. So support from the base cushion to try and stabilise the pelvis. We look at support at the PSIS level and lumbar support, contoured to mirror the shape of an optimal spinal position. The clinical goals of us for prescribers, what are we looking at then? Well, obviously, bringing people stability and positioning are absolutely crucial in order to maintain the most optimal alignment of the body posture of the spine. Positioning and stability, as we mentioned. Comfort and function, absolutely key drivers. If we can get people sat comfortably within a chair, but they can't function, or if they're not uncomfortable, how many times do people walk into a place and see a user, and then first thing you do is a lovely cushion, a lovely backrest, but if they don't report any comfort there, the minute you've gone out, they've taken that cushion off, they've got out of that piece of equipment, and it's left in the corner. So comfort is a huge driver for our seated position. Making sure people can function as independently, maximising their potential. Stability to make sure the arms are in space in order for us to work. Skin integrity, we make sure we look at that for our back support, to protect the skin from bony prominences. So what are the clinical advantages then of back support? Well, as we said, it provides optimal postural support in an anatomical alignment, making sure we have those very good anatomical curves, lumbar, thoracic, cervical. It improves pressure distribution, so we preserve in skin integrity, but we also need, going back to those clinical goals that we have, it can provide us with positioning, we can return people back to midline. That's our goal, to bring people back to that neutral, that reference position. Stability-wise, we need the backrest to provide the support for us to function, to gain stability. Comfort and function then, huge drivers. From a client's perspective, the user's perspective, is absolutely huge. It's probably their top concern. They'll go along with function. So what does the research say? Well, as we know, when we look at the information around on the support for the use of manufactured backrests, there's very little out there, there's very little studies that are being done. But of the ones that are out there, these are the reports that we've got so far. Basic sling seating can lead to pelvic obliquity and associated kyphosis with an increased risk of deformity, pressure ulcers and discomfort. Contoured backrests can stabilise trunk posture, reduce unequal weight bearing and reduce those shear forces from the pelvis. Adjustable contoured backrests improve postural stability and arm reach. Again, linking back to those functional goals that we've been talking about. Stability and function. The use of manufactured backrests leads to increased comfort and propulsion. So comfort, again, another huge driver, and propulsion. So link it into all these clinical goals that we got. Contour with the backrest decrease the seat shear. And then from a specific study looking at motor neuron disease, what we found that research actually indicated from a questionnaire survey that those particular group of clients viewed the sling upholstery was the most undesirable, the most particularly undesirable feature of their seating systems. So I open the question to the floor. What do you guys look for in your manufactured backrests? Throw some answers at me. What do you look for?
Lateral trunk support.
Great, yeah. Customization, ability to adapt to changing needs. Great. Anything else?
Back angle.
Back angle, angle adjustability, yeah, to make the backrest conform to the user, to optimize the support, absolutely. Anything else?
Lateral support.
Lateral support, we tapped into the lady at the back, absolutely, yeah. Anything else? Lumbar support, customizable, that inner surface, yes, absolutely. Let's take a little look. Addressing those clinical goals that I mentioned at the start. Make sure we have varying contour depths to match the shape and support that the user requires. We need those backrests to be customizable, certainly to be able to add, to change the shape of that inner surface, which contacts the actual user's skin. Angle and depth adjustment, as we mentioned there. But we also want backrests to be easy to handle, transport, prescribe, fit into the chair. And all of these things are really important key drivers for us. And as manufacturers, we've got to try and come up with these things. No one mentioned lightweight. And how many people say, oh, this backrest is very heavy when you're looking at it. It's a key, it's very important for the person who's collapsing that particular wheelchair. Maybe they're transporting it into a car. It's So JZ backrest, where did it come from? Well, it came back from users and clinicians' feedbacks where we were looking for a backrest where we needed more comfort and the potential to accommodate people's postures. How many times have people put lateral thoracic supports in to correct and straighten the spine into optimal alignment, and then you've received a phone call days later, come and take these lateral thoracics off. They're hurting, they're not in the right place. And you say, yes, but you're going to compromise your stability, your postural alignment, your balance. Yes, but I can't function. Always goes back to function. And then straight away, I'm not comfortable with those in. So these go back to those key features of backrest, those clinical goals that we're talking about. We wanted a much less complex backrest where the customised fit, going with the J3 with thin foam, very tailored shapes, wasn't required. We wanted something that we could pop into a chair, that people could relax and comforted, but also get support for their trunk. Okay, so this was our design concept and objective. This is what we were looking at, to offer a backrest that offered two postural shapes, the most common shapes recorded for support, for comfort, and positioning within the chair. So we've used shallow contour and posterior deep contour. A backrest that could utilise positioning items into there. We wanted to enhance comfort through looking at the foam and the cover technology to try and reduce heat and make sure we had immersion into that foam. We wanted simple fitting and mounting technology. The J3, when it came out, was revolutionary, dropped straight onto the backrest, really easy to lift on and off. But times moved on, technology's moved on, and what we need to do then is bring out a new style of mounting hardware. But ultimately we need to provide a comfortable seating solution for people where it was adaptable to changing needs. Our users are very much like a revolving door. They go out, but we know we're going to see them maybe 3-6 months down the line. Posture will inevitably deteriorate, and this is where we need a backrest that can actually reflect that and get support into the right place. So the target user group for this particular backrest is the semi-active users. Now specifically, examples of those would be patients who suffered stroke, multiple sclerosis, motor neuron disease, and the elderly population. These are individuals who require much firmer pelvic and lumbar support, lateral thoracic support as you've mentioned. They need a greater surface contact with their backrest to enhance their comfort. But the big thing is not to restrict their arm function. And when we look at the shape of the PDC backrest, it is designed not to impede shoulder movement. These are customers, quite often, that we found don't need that very precise fit that was offered by the J3. So where does this fit in within our range? Well, currently we've got the three backrest shapes. We've got the J Comfort backrest offering minimal postural support. You put a user in, they conform to that shape, they drive in their power chair. We often see it in those power chairs. But then when we look at the J Easy backrest, it fits that middle ground now. So we're looking at a backrest that it provides enhanced comfort, but we're also looking at providing mild to moderate postural support, if required. We've then got the J3, which still remains at the top end of our segment in terms of complexity and positioning capability, where we can get a very aggressively control people's posture. Okay, I'm going to scoot quite quickly over these product features, and then what I want to do is focus very much on the clinical cases where we might apply this backrest, because this is exactly why we're here. So product features-wise, we've got 4 widths. We've got a 14-inch wide, 16-inch wide, 18 and 20, and they all outward 2 inches. So we've got that, so we can upsize that backrest onto a wider chair should we need to. 2 contour depths, shallow and posterior deep contour, low lateral contour, and stabilize the pelvis. Keep arm function free. 3 levels of support. What have we got? 15-inch backrest, mid-thoracic, upper thoracic, 18 inches, shoulder height, 22 inches. Okay. We've tried to introduce new cover technology into that. So thinking about slightly thicker foam than the J3, still allowing that soft foam that we can immerse back into, customize that inner surface if we need to. But think about the outer cover, make sure that it's breathable. Heat and moisture can pass very quickly through to reduce the risk of skin breakdown. We need something that's easy to wash, quick to dry. For those people who are interested in it, come over and have a little look when you've got time. Come out and have a look at our backrest that we mount on there. Have a look for yourselves at the mounting hardware. It's got a 2-pin clamp, but with a 4-pin mounting position, as you can see there. So 2-pin on a round tube, with 4 mounting positions either side of the backrest now to give you that bit more stability in the backrest. Okay. As I say, I'm going to scoot through this because I want to focus very much on the clinical side of this particular presentation. All this information are in the leaflets that you've got at the very back. So come over and see us afterwards. Okay, clinical application. So I mentioned at the start about where we would actually apply these products. Because for me as a commissioner, I like to think, right, what group of clients do I position these particular products for? Well, when we look at the start, we mentioned about the elderly user group. Now, predominantly, a typical condition that we would see would be Parkinson's disease. And as we know with that, people tend to adopt these very fixed postures, certainly fixed thoracic kyphosis, fixed posterior pelvic tilt. Now, in this instance, look, what we can do with the J-Easy backrest certainly is angle the actual shape of the backrest plate, but also insert the wedges in to customize that inner surface. I truly believe that customizing that inner surface is absolutely crucial for comfort and for support. We need adjustment and ability to remove the backrest shell very quickly, but we need to customize that inner surface. It's absolutely vital. Now, I've got a backrest over here which I'm going to draw your attention to, folks. If you could look across this side for me. Okay. So on the chair here. So inside the back support. So when you look at that, there we can see. So building up, utilising those foam wedges, those packing pieces that we've all done. Excuse me, have you got a flannel? Have you got a pair of socks? I can stick it aside just to create that extra support. I see heads nodding because I did it myself. So when we have this back support, sorry folks, good awake. The people at the back that weren't listening. We can actually shape the surface now to actually reflect the user. So those principles we're talking about the spinal line kit, we can still do it with this. The thickness of the foam, and immediately people will look at it and go, it's way too thick, but it does actually customize. We can actually introduce those components to customize it for people. So in this instance, we can accommodate a person with Parkinson's disease, where we know tension adjustable backrest is not offering the support anymore. It doesn't give us that firm support that we need. What happens if that user starts to develop a lateral lean to the side? Compensatory scoliosis. In that instance, then, we can actually introduce lateral thoracic supports into that. We can use it so that the backrest then becomes customizable, changing, responding to changing needs. Okay. What about the predominance of stroke? We see that so often coming into clinics, people who suffer stroke, and certainly we're seeing individuals now suffering from stroke much earlier on now. It's affecting people younger. Well, as we see that when we take out that muscle function and the effects that has on people's sitting postures, we often see a pelvic obliquity with a compensatory scoliosis going on there. So what can we do with this easy back then to sort that out? To manage that person's posture? Well, we don't want to go for a J3. It's too complex, too precise, and I want something that's going to give that person comfort and support in the seated position for the time that they're in the chair. Well, in this instance, what we can look to do is use a shallow contour backrest and offset the lateral thoracic support. Those principles of that 3.4 load that we're used to using, we can do that with this backrest. We can achieve even greater amounts by using a swing-away lateral that's got an offset, a dog-leg bracket that can actually push the laterals either much higher or much lower down. So when we're looking at the backrest, trying to support in, getting that support, because our therapist's hands, our prescriber's hands are the most important bits. Getting those in the right spot is absolutely crucial. I don't want to be constrained by a backrest that doesn't allow me to get these in exactly the right position that I've looked at. And we've actually worked out, yes, that's the spot I want them. Let me get the laterals in the right spot too. Just one final group I wanted to touch upon. The MND sufferers. Now, when we look at those people, certainly towards the mid to end stages, where they've got very low muscle tone, and we've lost function there, they've lost their function. For those people, comfort is a huge driver. They just want to be comfortable for the remaining time that they are with us. But also, we need to support them in the best posture that we can to maintain that alignment, to prevent contractures and other secondary complications. Well, in that instance, what can this JZ backrest do? Well, for those particular users, what would I be looking at? Well, certainly to introduce much higher lateral thoracic support, deep, contoured backrests. Well, the JZ backrest, as I said, has been designed to take away, to allow and optimise as much arm function as we can. But introducing lateral thoracic pads to extend this surface up now can actually keep our trunk in midline, whilst also adding that soft comfort that we've got in there as well. So when we look at that, we can see these 3 examples of where we can actually relate this backrest to client groups there. Come over and visit us on the stand afterwards and have a little sit in one of these. I'll drop them onto the chairs. See for yourself what it looks like, what it feels like. Because at the end of the day, I can point you in the right direction, but you yourselves as prescribers need to make up your own mind whether this stuff works. I believe it does. So just going back to finish off. The JZ backrest, it fills our gap in the mid part of the range, It tackles those clinical goals, meets those clinical goals that we want for positioning, stability, that skin protection, maximising comfort and function. There's 2 drivers which are very, very important for our users. I then pitch the question back to you and think, okay, so solid manufactured backrests, are they the best way forward? I think so, certainly to get the support in the right place and to customise the inner surface. And we're going to see certainly with different manufacturers out there now, lots of different variations on that. I definitely think that there's a growing trend to prescribe more solid manufactured backrests, certainly as we start to see that we can actually support people in a much better position now from using these backrests, but they've got to have the features that we as prescribers need. Adjustability from behind, ability to change, and also to meet the user's needs from the front perspective, comfort and function. Thank you very much. Any questions? Okay, that's good. I don't mind that. Questions? Please come and see me after. I'll be on the stand to answer any clinical questions that you've got, or any feedback, thoughts.